I'm Dr. Marc Strickland. You just call me Mark or Dr. Mark, like formalities are not necessary. So I guess I'll just start by like giving you a little bit of my history. So I was an undergrad psych major back in the 90s. So I got a BS in psychology. I got a master's degree in exercise science. I have a doctorate in clinical psychology. And then along the way, there's lots of, twists and turns. So I was a student athlete at College of Charleston. And I was psych major, and I'm like, not in a sport where I'm gonna go make millions of dollars, probably not even make hundreds of dollars if I stayed in my sport. So I was like, okay, what the hell am I gonna do with myself? Do I want to coach? Do I want to do this? Do I want to do that? And there was a class my sophomore year called the Psychology of Sport, and it was co-taught by a woman in the physical education department and a guy in the psychology department. And I was like, that's me. How do I get there? Right? And so at that time, graduate schools there were just a few select grad schools. They were even hard to find. There weren't many opportunities. Certainly, there was no athletes talking about the mental game. There was no, regular, ESPN stories on, Naomi Osaka dropping out of the US Open, or Simone Biles dropping out of the Olympics, or Kevin Love having a panic attack at the halftime of the game. That stuff didn't exist, right? So that kind of started me on this journey. That was in 1992. And so from there, after I graduated, I took 2 years off from school, did a few things in my personal life, and then started to find a grad school. And I'm from North Carolina, and I was lucky enough to get into the University of North Carolina, Greensboro. My mentor, Dan Gould, if you've read anything in sports psych, you've probably come across his research because he's prolific in his researching. And he's written several books and thousands of articles and et cetera, et cetera. So he was my master's degree mentor. I got a master's degree in exercise science with a concentration in sports psych. But that didn't give me a license. That didn't give me anything to operate with independent of just saying, hey, I kind of know this stuff. It didn't give me any mental health training at all. So from that point, I took a fellowship at Penn State University in their athletic department under their sports psych person, Dave Eukelson, and went up there and worked for a year in their athletic department, 29 athletic teams, and just trying to find my way, cut my teeth, learn my craft under his supervision. That was just a 1-year position. So after that, I actually went back and started a second master's degree, but that was a bad decision on my part, and so I came out here to Arizona and got my doctorate in clinical psych at Argosy University, which is no longer here. And this all the time, everything's focused on sports psych. That's kind of my track, right? And so while I was out here, clinical psych program. Just FYI, all clinical psych programs are exactly the same, right? From a coursework standpoint. The APA, if it's an APA approved program, which it better be, because if you don't go to an APA approved program, there's only a few that aren't, you're gonna have trouble getting stuff later in life. But if you go to an APA approved program, they're all the same. It doesn't matter if it's Harvard or whatever. The programming is all the same, with the exception of your few 4 or 5 courses in your content area. So if you want to be a forensic psychologist, or if you want to be a sports psychologist, or if you want to be a child psychologist, or if you want to be GERO or IO, not every school offers coursework in every sort of area. So if you're looking at grad schools, you need to make sure that the professors there and the program there has interest in the areas you're interested in, right? So that's kind of an important side note. We'll talk more about education a little bit. So I came out here, I got started my doctoral program in 2000, and it's 5 years. So your first year is all coursework. You just go to class, you get murdered, every day, learning, right? I work part-time. And then your second and third years are when you start your practicums. That's when you start your training. So you coursework, you take fewer classes, but then you go and you get supervision. and you work in various settings, depending on where you get placed by your school. So my first placement was at the county hospital down Van Buren in like 20th Street. And I worked in an inpatient psychiatric, short-term inpatient psychiatric treatment room, right? The room was about this big, everybody there was a resident, the door was locked, you had to unlock it to go in, you had to unlock it to go out, right? And I was working with, basically people that the police were bringing in that were having mental health crises of all descriptions. Psychosis, SMI, schizophrenia, bipolar disorders, alcohol abuse issues, just whatever got brought in by the cops in the ambulance, right? So I'd run groups on medication management, it wasn't like really therapy, like in the sense that like one-on-one type of psychotherapy, but it was a great training ground, right? I had people scream at me, we had to take people down who were psychotic, we had to, collaborate with psychiatrists and testing, and every day was a new experience. Like every day you might see the same person 2 days in a row and they're radically different people because they've gotten back on their medications, and one minute this woman's screaming at me, telling me I'm the FBI and I'm the cops and she's gonna kill me, and the next day she's like, hey, nice to meet you, like I don't think we've ever met, and I'm like, we just had a confrontation yesterday, right? So I really got exposed to like mental illness, right? That's mental illness. And that was see some stuff in there that I've never seen in my career since, right? So that was my first practicum experience. You get 500 hours there, supervision, all that good stuff. Second year, third year, same thing, sort of lighter coursework load, and I went down to Tucson 2 days a week, and I worked in a chronic pain facility. So it was 3 physicians, psychologists, myself, and then across the halls a physical therapy clinic. And we treated people with chronic pain of a variety of choices. A lot of people with failed back surgeries, endometriosis, chronic pain syndromes, and so the docs are treating them medically, and then we were treating them psychologically. Anybody who had to have surgery had to be cleared by psych first. So we did testing and things like that to make sure that they were in a healthy enough place emotionally to manage the course of that surgery. And most of them had had several surgeries that had failed or not done well or whatever, for whatever reason. So, and then we had collaboration or ground rounds with the PT clinic next door where we basically triage every client every week to make sure everybody's making progress. And so that was a great experience from a medical standpoint, understanding the relationship between the body and the brain and how things transpire, what happens when we're under pain, what happens to our bodies physiologically, and how it rewires and re-engineers the brain, and the sensitivity to things like cortisol and hormones and adrenaline and all those things, and how do we kind of like undo that process. So that was my second year. And then my third year, I actually worked right here at Grand Canyon University. So my fourth year, so third practicum. Same thing, lighter coursework, you're starting to work on your dissertation, which is just a fancy word for a big research project. And then you do your advanced practicum, which for me was sport, right? So the first one was mental health, the second was chronic pain, the third one was sport. Grand Canyon had not 10 sports at the time. None of this stuff was here. The basketball gym was still the little old gym over there. Baseball stadium was like the best thing. They just added women's softball. That was the 10th sport. There was a swimming pool, but they dug it up. Now I know there's a bigger pool here now. So, but yeah, I came over here 3 days a week, and I was essentially the sports psychologist in the athletic department here. I had had that training at Penn State, so I kind of knew how to manage teams, manage the season. Keith Baker was the athletic director at the time. He's probably served in every role in the athletic department and might still even be here, from he was a student athlete here to anything and everything. So I worked here for years, seeing athletes, working with teams, working with coaches, and finishing my coursework and my dissertation. And then your 5th year, you go on internship. An internship is a national match. So you put your name in a database, and long story short, you put a name in a database, you rank order of like where you want to go based on like your areas of expertise or your areas of where you want training. And there really weren't many training opportunities for sports psychology. So I was like But you gotta get something, because if you don't get that internship, then you have to wait a year, reapply for internship, and that just delays your graduation, right? So I was fortunate enough to get an internship in New York City, in an outpatient substance abuse treatment facility in Lower Manhattan. So I packed up all my stuff and I moved to New York City, and I lived on $2 slices of pizzas, and a buddy of mine from college had an apartment there, so I lived with him on his couch for a while, and then he was moving out, so then the last 6 months I kind of took it over myself. But I lived in Upper Manhattan, I worked in Lower Manhattan, and I was a poor student in Manhattan for a year, treating basically all my clients were people who had gotten arrested for drug possession, trafficking, whatever, and they had two choices: go to jail or go to treatment. And so they were mandated to treatment, which is a whole nother ball of wax. Somebody's calling my office and saying, hey, I'd like to come in, I think I have a drug problem, I need some help, blah, blah, and somebody's saying, the judge put me here and I don't want to be here, and fuck you, and what are you going to do to me? I'm like, well, I'll put you back in jail. I can do that. Okay, well, I'll pay attention. All right. Oh, and by the way, you got to show up twice a week for individual, once for group, yada, yada, yada. And most of my clients lived up in Harlem, and it was like an hour and a half subway ride down, and so there's all kinds of, issues like that. I had to drug test them every session, so I had to watch them pee in a cup, all that good fun stuff that you don't learn in grad school. So that's kind of my academic journey, right? And then after that, finished my internship in New York, came back out here, and at the time, the rules actually changed. I was actually the last person to fall under this category. You used to have to do a postdoc. So you couldn't get your license as a psychologist until you did an additional year of training under someone's supervision. We called it postdoctoral experience. So I joined a private practice here on the west side of town with a colleague named John Stapert. He supervised me, and in that practice I did general mental health. I was on staff at Arizona Heart Hospital, on-call staff, because they don't have a psychiatric unit. So if somebody comes into the ER or whatever, or someone's like acting unusual after surgery or something like that, then they would call us in for a consultation to see what we should do. So I would take call on the weekends and go there. We had to be there, like they called, we had to be there in like half-hour notice or something like that. So it wasn't like crazy, I didn't have to live at the hospital, but like I was responsible. And again, they call, I go to the ER, I don't know what I'm walking into. I could be walking into somebody who's schizophrenic and is, self-stimulating, or I could walk into someone, who's just a drug overdose, or you never know. So it put my diagnostic skills, it elevated my diagnostic skills, because in my private practice now and previously, like I work with the healthier end of psychology. I don't see SMI, I don't do anymore, I don't do bipolar disorders, I don't do psychotic things, I don't do those cluster B personality disorders. Like that's not what I see in my private practice, right? That's not what I'm trained in, that's not really what I'm good at. But when you walk into a hospital situation and you're on call and you have to cover it, like you have to be able to see the whole DSM, right? And you got to be able to diagnose it in 45 minutes to an hour if you can get that long. And then what do we do with them? Are they psychotic? Are they suicidal? Are they homicidal? And like where do we place them? Because the Arizona Heart Hospital doesn't have the resources. So how do we transport them? How do we get them to community resources? Med Psych Hospital, what do we got to do? Because even the docs there are like, we don't know what to do. You're supposed to do it, So, so that was, again, diagnostically, it elevated my ability to see across the whole spectrum of mental illness. And in that same time, I was building my own private practice, slowly, and then I got my license. So I got licensed in 2007. And take my board exams, get all my paperwork in, all my hours, all my letters, blah, blah, blah. Board certifies me as passing all the core requirements. 2007, I get licensed. So now I'm on my own. I'm free to operate independently, but with that comes responsibility and financial, like my liability license doubles. As a student, I had liability insurance through the APA, and it was like nothing, because you're always operating under somebody else's license. As an independent practitioner, now it doubles immediately, pay us. Because if you don't get this license, I mean, if you don't get this insurance, you can't operate, can't work, right? So now I gotta come up with that money. So, so 2007, I got a little bit of a private practice going, you know, making some progress. I got a few little contacts for seeing a few little like high school level athletes, and a mentor of mine here in town says, hey, will you come and speak at the Arizona Psychological Association this year on sports psychology? And I was like, do I have to? And she's like, yes. Because she mentored me, she was good to me. She treated me well, and she helped me out a lot in my career. So I said, okay. So thankfully she did, because at that presentation I met a gentleman who was a psychologist and who worked for the Oakland Athletics, running their employee assistance program. He said, hey, I think there's a spot for you with the organization. Would you like to interview? I said, absolutely. So 2007, I interview with the Oakland Athletics, and I start working for them really part-time, like 1 or 2 days a month. I'd go out to their spring training facility in Phoenix, and I would meet with athletes that are there for injury issues, or you know, mental health wasn't really like a thing for athletes at that point. So it was just performance enhancement work, people trying to get better, people, you know, coming back from surgery, elbow surgery, Tommy John's, things like that. And so I worked there for 3 years, 7, 8, 9, and 10. And in 2010, the Chicago Cubs called me and said, hey, we've heard good things about you. We'd like to hire you full-time. And I was like, okay. We don't have a program. We want you to build a program, and tell us what you need to do that. And you know, we want to hire you. Great, absolutely. Resigned from the A's, started with the Cubs, and I built a program there. 4 years. I was with the Cubs for 4 years. 10, 11, 12, and 13. I spent 28 out of 30 days a month on the road, traveling to their various minor league teams and the big league team for the first 2 years. And then the manager, they changed managers, and he said, I want you here in Chicago full time. So in the last 2 years, I traveled with the team exclusively full time. And still tried to bounce down to the minor leagues a little bit, but it was only like on off days and things like that when I could get around. And then I got fired. The team had been sold from the Tribune to the Ricketts, who now own the team. They changed leadership, they changed managers, and anytime that happens in professional sports, everybody else gets fired eventually. So I got fired. I mean, in the middle of a contract. So I've never been fired in my life. I've never got fired from a job, ever. And I was like, you know, they flew me to Chicago. I was here working. It was in September, and they're like, hey, Mark, we need you to come up to Chicago. Okay, it's not uncommon for that to happen. I go up there, I walk in a boardroom, they sit down and said, we're gonna let you go. Thanks for your service. You know, feel free to get your plane ticket home. No questions asked. I didn't get a chance to ask questions, feedback, nothing. Like, hey, what the hell? They just fired me, and I walked away. I came home, told my now wife, well, yeah, we were just married at the time. Honey, I got fired. She's like, no, you didn't. No, I got fired. Fuck those people. Never seen one kill them. My wife's also a psychologist. So, so I set out for a year, right? Started rebuilding my practice a little bit. Because again, for 4 years straight, I traveled 35 weeks a year. I was gone all the time. I came home a day or two a month, if that. And the last 2 years with the Cubs, I left at the big last day of spring training, and I went to Chicago with the team, and I didn't come home until the season was over, whenever that was. So I was 8 months gone for 4 years, basically. So I sat out for a year, rebuilt my practice, kind of, try to figure out my own life, what I want to do with my career. And the A's called me and said, hey, the guy who had originally hired me was retiring. You want to come back, take his position over, and also build a performance enhancement piece to this. Full time, et cetera, et cetera. Absolutely. I'll be happy to come back. So I went back to them. I worked 8 more years for the Oakland A's until 2022. But same thing, same life. traveled all the time, 30, 35 weeks a year. I was gone 4 or 5 days a week. You know, and I was in the Dominican, I was in all over the country visiting minor league teams. I was with the big league team time to time, spring training, which is, you know, just getting ready to start here in a couple weeks. Like, I was just working my ass off. I worked 70, 80 hours a week. You know, the phone was always ringing. If I was home, I was either on the phone or checking emails or checking scores or something was happening somewhere. And in 2022, I said, that's enough, I'm done. I'm burned out. I'm working way too much. I don't find enjoyment in this job. I love the athletes, I love the staff, I love when I'm with them, but all the other stuff, it's too much. I had to have back surgery, I had to have a few other things, and it was time for me to stop. So in 2022, I stopped, I resigned at the end of the season. Took them about 4 or 5 months to find a replacement, so I stayed on just to make sure the athletes had services. And then I jumped back into my private practice and have restarted that, although it's still small, and then I do some work over at ASU as well. So that's kind of my journey, right? It's twisting and turning a little bit. So from there, any questions so far? I also got married. You know, like, I took 3 days off in spring training so I could get married, because my wife wanted to get married on a specific date that was important to her, but it was also right in the middle of spring training, so that was like a terrible idea, but also a wonderful idea to marry her. I had back surgery 8 weeks prior to my wedding, so I got my back brace off the day before I walked down the aisle, you know. So like, I danced one dance with my wife because that's about all I could tolerate, and then, you know, I sat in the chair the rest of the time. So like, my life was never my own. So now I'm home every night, and, you know, I get the variety and diversity in things I do, and I get to support her in her career, because she's got some opportunities now that are wonderful for her career, and I get a chance to do some of that stuff for her because she did it for me for 16 years. I mean, I worked in baseball 16 years, and I was gone all the time. So that being said, right, any questions about any of that stuff? Yes?
During like your education journey, you were talking about how like you worked in a lot of different like locations and with a bunch of different people. Which one do you feel like was like the most impactful to you during that time?
They all serve different purposes. Like, for me, in my doctoral program specifically, because the sport piece was just such a small part of the training, because you have to get all the other mental health stuff, right? Everything that I did, every training opportunity I got, I knew it wouldn't be sport. I didn't need that piece as much because of my master's and stuff, but I wanted something that was sport adjacent. So I needed to understand mental health. I knew nothing, you know, so that county hospital experience like introduced me to everything under the sun, right? I knew what schizophrenia was from the DSM criteria. I'd never seen it. Like, I'd never actually seen a schizophrenic person in my life. So unless you work in that type of setting, you're not gonna see them regularly, right? I didn't know I knew what all the criteria were, but I didn't know what it actually felt like to see that and experience it as a therapist. So that gave me that range of experience in the DSM. You know, working in chronic pain, well, injuries and pain are part of sport, right? Big people run into each other, they get hurt. So understanding like alternative methods to manage pain, not just meds and alcohol and whatever. So that was really valuable to me. So I sought that out. Working in substance abuse, right? Drugs are part of sport, alcoholism, all the kind of dysfunctional behaviors. So that was a really good entry and understanding into like that part of it. So they weren't one better than the other, but I was intentional in seeking sport adjacent areas that would be something I would have to approach if I work for a team, or it walks in my office and you're like, hey, I'm a blah, blah, blah for this team or whatever. You're not coming because, you know, you just, at least at that point, you didn't come because you just felt like it, right? Now, radically different. When I started working in baseball, it was like, fuck you, don't ever talk to me, right? Like, I had guys say that to me, don't ever look at me, don't speak to me, all right, man, like no big deal, right? And now, at the end of my career in baseball, it was like, hey doc, can we chat tomorrow? Or hey doc, can you come down to the bullpen and watch me throw this bullpen so you can help me like refocus, learn to refocus? It was coaches saying, get out of the way, you're in the way, to coaches saying, hey, will you come out here and help me help this player, right? So there's been a radical shift, and I've seen both sides of it, right? And not good or bad, it's just like where the silver lining in COVID is we actually give a shit about mental health now, right? Now, the government and the insurance companies still don't give a shit yet, but like, you gotta understand, like, at least the society gives a shit about mental health, right? So that was kind of the silver lining in COVID for me, right? And now the athletes are starting to really give a shit about it because they understand how impactful it is in their lives and their sport, right? So each one served a very specific, but I was intentional about finding those things, because I could have just taken whatever my school wanted to assign me to, and I mean, you have some input into like, I want this type of opportunity, but if your school doesn't have that opportunity, or somebody else gets it first, right, then you have to, you know, get what you can get, because you gotta get your hours, right? You gotta get 500 hours each semester, or each year. You gotta get 1,500 hours on the internship, because you need all those hours to get licensed. You need 3,000 hours to get licensed, right? That's not 3,000 hours of therapy, but there's a ratio of therapy, administration time, supervision, et cetera, right? So you need those hours, you gotta crank your hours down, right? And then along the way, you need things like, I had to do so many personality tests, I had to do so many intelligence tests and things like that, because the school had a minimum requirement that you have to have the experience in these areas, right, to graduate. So you also have to find your sites that would get you that experience, you know? So you kind of have to create some diversity for yourself. But you gotta be intentional and you gotta seek it out. So they were different in different ways, all beneficial, right? So, yes?
What's the process of building a private practice like in sports psychology at least?
Well, I'll tell you this, I don't know how many I'm assuming everybody here is a psych major, right? Like, graduate school, undergrad and grad school is gonna teach you nothing about running a business, okay? I was fortunate enough, I grew up in a family business, my granddad started a business, my dad took the business over, my brother took it over from him, so like, I lived in a family business and I understand like business and taxes and stuff, because it was part of the conversation in my house all the time. But grad school is not gonna teach you anything about running a business. It's not gonna teach you anything about getting on an insurance panel, paying taxes, quarterlies, 1099s, W-2, nothing, right? So if you are an undergrad, I would say at least take a business course or two that helps you understand how to set up a business, an LLC, an S Corp, do you want a C Corp, like tax and liability, how do you want to manage that? You're gonna pay quarterlies, you're gonna pay semi-annualies, you're gonna 1099 your employees, or you're gonna W-2 them, right? So that's a different process, right? So, so for this state, right, I mean, you can go out and you can be an S Corp, an LLC, you know, a sole practitioner, there's various like, and that's all tax structure, right? Corporation tax structure, and there's pluses and minuses to each one. But for me, the very most important thing to run a business is creating relationships, right? So I started this private practice with 0 clients. I have a mentor who's, you know, in his 60s at the time. He's got a full practice going. He can dump a few patients over to me, right, and get me started, but I had to go out and beat the streets to get my own clients, right? So it's, who's gonna refer to me? Sports med physicians, okay? There was a sports med physician up the street from where our office was in Glendale. First place I do, walk in, here's my cards, this is who I am, you know, blah, blah, blah. He was a great referral for me, right? PT clinics, orthopedists, coaches. So my goal every month was once a month to speak at some sort of sports club, the local triathlon group, the local running club, the local tennis league, whatever. I would volunteer to speak once a month, right? Just like I'm volunteering to be here, right? If they get a client or two out of it and I see them for 2 or 3 sessions, that was an hour of my time well spent, right? You know, some people were like, oh, you should write articles or this, and I'm like, I don't like to write, number one, I'm not very good at it, right? And number two, like, that takes time. I could give the same presentation every month and just changed the sport, right? So I didn't really have to prep for that. Like, I didn't really have to prep for you guys. I can do this stand on my head, right? Because I've done it so much. So, but writing and editing an article, and sending it in, and have it come back, like, that's just too time consuming. That's money is going wasted. Because if you're not with a client, you're not getting paid, right? Like, to be here costs me money. I could have seen 2 more clients tonight, right? So, but that's my choice, right? But if you're gonna do this and sacrifice $400 or $500, like, where are you gonna make it up, right? So for me, it was always about relationships. Who's gonna be my referrals? Where am I gonna go to find those people, right? Where am I gonna go so they pick me over some other psychologist that's like closer by, right? I used to take insurance a long time ago. I don't anymore because they don't pay for what I do, right? They don't pay for performance enhancement work. They don't pay for anxiety management because your attendance service, terrible, right? So I don't take insurance. It's not very, from a financial standpoint, it's not to your advantage to take insurance as a psychologist. Now, it's a way to get a lot of clients, because if you're on an insurance panel and that person calls and says, hey, I'm looking for a psychologist that lives in this zip code, and they get your name and you're close to their house geographically, like, that's probably where they're gonna start, right? But from a financial standpoint, the money you have to, your fee and how much you have to cut your fee for what the actual insurance company pays, right? It's a losing bargain, in my opinion. I can work, if I took insurance right now, in a normal 40-hour week, a traditional full-time schedule for a psychologist is 20, 25 hours, right? If I took insurance, I'd have to work all 25 hours to make what I'm making now, working half the time, but charging my full fee. Now that means some people can't come see me, right? So that's a trade-off, right? And sometimes I drop my fee, right? There's times where I've had a few athletes that were dirt poor, and didn't have a lot of money, didn't have a sponsor at the time, and I would see them for free, right? But that's my choice. I'm choosing to do that. You don't ask me for that, right? Whereas in insurance, like, insurance just sends me a check for this much and I don't really get to argue. Hey, I'm worth more than that. Well, tough shit. You have to write that off, right? So there's a lot of layers to running a business. Like, what, are you gonna run a group practice where it's you and 6 other practitioners and you guys are sharing the pot? Are you splitting it equally? Are you, and there's different practice structures that people operate with, right? But I'm also gonna assume your liability. So you screw something up, do something unethical, that might come back on me too, right? So how do we create safe nets for that, right? I'm a sole practitioner. I don't wanna pay anybody to work for me. I don't wanna manage people. I don't like to do that, right? So I've always been a one-man shop. You call my office, you get me on the phone. People are like, oh, sorry, did I call your back office number? I'm like, no, this is the number. You got the doctor. I don't have a secretary. I don't have a MA. I don't have a, you just get me, right? It's just easier for me to keep it all organized that way. Plus, I don't have to pay somebody, right? But if you want to be in a big group practice with 30 people and staff and and interns, and great, right? But there's expense to that, right? Renting an office space, and I don't even have an office. I have an office in my house. Right? You just come in a side door and you write my office, right? I don't have to pay rent, and I can write that off on my taxes, So if you're gonna open a private practice, hire an accountant, very first thing. Even if you can't afford to pay him much, hire an accountant, and then get an attorney or someone to help you incorporate your business. And every state has different rules and sets, but you have to file some paperwork with state, and the title of their business has to be verified and blah, 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 so it's not conflicting. You can't call your office, something similar to that. So all that's just legal bullshit. You pay someone to do that, right? Yes.
Looking back on all your stuff at school, specifically, because you said you just got an undergrad in general psychology.
Just a BS in psych. Just a BS in psych.
Yeah, so that's kind of where I'm at right now, so I don't really know specifically where I want to go with it. Is that, would you still recommend that, or would you say, like, if I try to focus on something that?
I mean, partly it's like, if you think you want to stay in the psychology field, an undergrad psych is useless. For any, like, if you don't want to be in psych, if you don't want to get a master's degree or whatever, and you don't want to work in this field, like, a BS in psychology will get you a job at Starbucks, right? Like, whereas if you got a job in business or something like that, you could kind of go in a lot of different areas. If you're like, hey, I want to stay in the mental health field, and you might not know what you wanna do in that field, you need to get an undergrad psych because it's gonna set you up from a prerequisite standpoint to get what you need to get into grad school, right? If you go into grad school with a BS in business administration, they're gonna be like, where's your psych classes? You're gonna have to catch up all those prerequisites, right? But, you know, I know that's one of your questions, like, if you think you wanna stay in this line of work, you have to, at a minimum, get a master's degree. Now, you could get a master's in social work, you can get a master's in counseling, you know, and they give you licenses, right? Those licenses, you go get an LPC, licensed professional counselor, you can get a licensed clinical social worker, right? You can do those things, right? There's 2 years in addition to your undergrad, but it also limits some of the things you can do. Like, they can't do testing, right? I can. So you kind of have to think about like what it is you want to do with your career. Start at the end. What do I want to do? What, you know, I'm at my retirement banquet. What do I want to have, you know, done in my career? If I want to work in a school psychologists don't have to be licensed, right? At least in this state. Other states may differ, right? And that's the other thing is like every psychologist is state by state. The requirements for California are different than Arizona, right? So that's another thing is if you want to live somewhere else, as you're going through this process, you need to make sure you're meeting that state's requirements, right? And there's no reciprocity from state to state, right? So I'm licensed in 4 states, here, California, Illinois, and South Carolina, right? We also have an interstate compact system, which is like it's reciprocity, but it's only for 30 days, and you have to practice for 5 years, and you have to meet all these requirements. So like, it's not something you just do right away. Like I can't just fly wherever I want to go and be a psychologist, right? So there are some limitations to that, but at least it gives me a little bit of flexibility, right? But yeah, if you're like, yeah, I want to stay in this field, like you need to start looking at master's, doctoral programs, and then there's a PhD versus PsyD, right? PhD is a research degree. You're training to be an academic, really, right? I have a PsyD. That's a clinician's degree. You're training to be an actual clinician, you know. So those two, in the PhD, you're gonna do a lot more research, you're gonna do a lot more grants, things like that. But if you wanna go in academia, like, that's not a bad way to go, right? If you wanna be a clinician, I could still be a professor. I have taught classes in the past as an adjunct, right? But I don't wanna be that, right? That's like something I did in addition to my clinical work. So to answer your question, like if you're not sure what area of psychology you want to go into, I would say good. Take classes that expose you to the various areas of psych. Gero, neuro, child and adolescent, sport, neuro, my wife's a forensic psychologist. And so, you know, in psychology you can do a lot of things like you can do things from, you know, some companies use psychologists in their product design. Some, for court, people I have a friend I went to high school with actually, and she's a jury consultant for, you know, major trials. You know, my wife's a forensic psychologist. She goes into the prisons and works with people in death row and she testifies in court and, you know, so there's a lot of things you can do other than just therapy, right? There's a lot of other avenues that are explorable, but you have to kind of create that for yourself along the way. You're not going to get that in your traditional training, right? So hopefully that answers your question. There was a question over here somewhere. No? Yes?
What's the main difference between an internship and a fellowship?
The fellowship didn't give me any hours. Like I got supervision, but it didn't like count towards anything, right? The internship is through a national match. The APA, all these sites around the country say, we want to provide internships. The APA goes to that site, visits it, makes sure they've got enough supervisors. There's all kinds of protections and things like that in place. And then they certify that as an internship site. And then when so like right now, interns who are trying to be interns going on internship this year in August, they're putting in their applications right now. There's a national system. Here's all the internships that are available this coming August, right? and then you apply. Everyone has maybe a little bit different application requirements. Then they select like who they want to give interviews to. So some of that's online, some of it, I flew to Kansas, I flew to North Carolina for internship, and that's all coming out of my pocket, by the way. They're not paying for it, right? And then there's match day. So when internship, it closes, you rank. This is my first choice, this is my second choice, this is my third choice, fourth, fifth, if you get that many. And then the site goes, this is our first choice, this is our second choice, this is our third choice, of all the people they interviewed, right? So if you're number one on their list and they're number one on your list, boom, you match, right? But if you're like 3 on their list and they've only got 3 spots and they're 1 on your list, you might still match. So, and you might not match at all, right? So then there's a clearinghouse, which is like all the sites that are kind of left that didn't get filled. And it's like mad dash on Monday to get your like faxing, that's old school, like emailing and whatever, to get yourself in front of them to do an interview real quick on the phone and see if you can fill that spot for them, you know? So it is a very hectic process, and it's getting more hectic because the internship sites are diminishing and the number of applicants is growing, right? But again, partly that's because of COVID, that's like fallout from COVID, but it's expensive for these sites to have interns. Like I think the application, or just to be granted an internship site from APA, it costs him like $15,000, $20,000 just to work through that process, right? So like me, sole practitioner, I'm not gonna do that, right? But then there's liability too, because you work under my license. You screw it up, I get sued, not you, right? You screw it up, I go to the board and say, I can't say, well, my dumb intern did it. Well, then I go, well, why weren't you supervising your dumb intern, you know? And you gotta go, well, I was supervising it. Well, you weren't doing a very good job, right? So you're still in trouble, right? And once you get your license, like, the learning doesn't end, right? Now, again, different states have different requirements, but in this state, it's 40 hours of continuing education every 2 years to get my license renewed, right? So that's money, right? It costs me money to get continuing education, right? I gotta go to conferences, I gotta pay for online training, I gotta do things, right? So that's money on my pocket, that's time away. Oh, I wanna go to this cool conference in Hawaii? Yeah, great, okay, so it's 5 days, it's $10,000 for hotel, car, flights, food, you know, the conference fees. Oh, and I lost 5 days of income because I wasn't in my office seeing people, right? So now I'm losing, oh, and my next week back is not full because I was gone for a week and didn't get like to put people in my schedule for this. So like you lose 3 weeks, right? So versus, oh, I can do this online training for like half the price, stay at home and, you know, maybe not be in Hawaii, but like I can still see clients that afternoon or that night or what, and I can keep the phones going and I can do all those things. So, you know, those are all business things that you know, you have to weigh, you know, is it worth it? Like somebody's gonna have me come speak at a conference, right? You gotta pay me, right? I mean, that sounds callous, but like, it's too much out of my pocket to go for 3 days and speak at this conference and do it for free, right? Come and see you guys for an hour, like, okay, it took me an hour to get here, I'm missing an hour of like clinical work. So that's a little bit of money, but you know what? You guys need to hear the honest truth. And, you know, I'm certainly not afraid of being honest. And, you know, at the end of the day, like, hopefully you guys all get a little something out of this, right? And, you know, hopefully I've shared a little bit of knowledge. So it's not that big a deal, right? But, so you have to, if you don't learn anything else I say tonight, if you're gonna be a psychologist, you gotta learn your value, right? What is your time worth? Because time is all you have in this world. Other people go to work, and if they do a good job, whatever they're doing as an economist or a business person or whatever, right? Their check's the same every week, right? I don't see 20 clients this week, my check's different, right? So you have to know what your time is worth. Because most psychologists aren't gonna tell you what they charge, right? So you gotta be comfortable with like, what I charge for my clientele, for my line of work, based on my experience and my training and all the things that I have being in the field for 20 years now, right, is different than, let's say, your worth as a first year, you know, licensed psychologist. Doesn't mean you're not good at the job, but with experience comes value, right? So, but you gotta understand what you're comfortable with, right? what you're comfortable charging for your time. And most psychologists are shitty business people, right? Because they're empathic and they don't want to see people suffer, and they realize that if you can't afford their fee, like, you might not get help. And yes, that's important, right? But you're also running a business. Just like, you know, Jerry Colangelo's running a business, or Kentucky Fried Chicken's running a business, right? You got taxes to pay, you got bills to pay, you got, you know, rent to pay, you got liability insurance to pay, you got all these, like, and yeah, if you want to take that discounted fee here or there, okay, but it's your choice, right? But you still got a bit, the IRS is still gonna collect their taxes every quarter, right? Pay taxes 4 times a year, you know? And sometimes it's, steep, you know? You make a lot of money, pay a lot of taxes. You don't make much money, you don't pay much taxes, right? So it's a trade-off, right? And how do you use your corporate structure to help you mitigate some of that, right? That's where your accountant comes in, right? So it's a learned business, yes.
During like college and your academic, whatever, did you have a job? Do you recommend having a job? What kind of job did that look like? Did you?
Undergrad, no. I was a student athlete. Like this NIL shit, that didn't exist back then, right? We couldn't even have jobs. NCAA would not allow student athletes to have a job because they would say it was an undue benefit, right? So college, no. Undergrad, no. Does that mean you shouldn't have a job? No. But if you want to get experience, experience in this field, right? Your job opportunities are limited as an undergrad because you don't have any training. You don't really know very much. And so like someone like me would be like, that's too much risk, right? Where you can work, and like my wife did this, granted she was in her doctoral program at the time, is finding a psychologist who needs office staff, right? Someone who is willing to pay you 10, 12 bucks an hour to come in and answer the phones and do the paperwork, hand the clipboard over to the person, file the paperwork. Like someone like me who's like, you know, maybe there's just 2 or 3 people in the office and they don't want to pay for a front desk person, and you can go in there and get some experience of like running the business, and you can talk to them about the field, and if they, you know, if you start to get some knowledge and you start to get some trust, like maybe you could do some of the testing for them, right? Some of the easier testing, like giving out the PAI and having the person fill it out, and then you score it so the doctor doesn't have to, right? Because it's just a template, right? I'm not saying you're gonna give a full WAIS, which is an IQ exam if you don't know what WAIS is, but like you can give some of the more simple basic tests, right? So you're starting to get experience, right? You're starting to see the field, you're starting to see the people walking in the door, how they're getting clients. So that is an option. That's probably one of the few options as an undergrad, is like finding somewhere that you can work in a more administrative role to get some knowledge, yes.
So, so you've been going to many different universities and collected many different academic experiences for different internships and stuff. Would you say it's a big disadvantage to go to only one university to get like from your undergrad to your doctorate or something?
I won't say it's a disadvantage, but I do think it limits you in some way. Because this job is about relationships, right? Not only relationships with like who's gonna refer to me, that's professionally, but like I didn't get started, like I had to have relationships to get myself started. So like Dan Gould, who was my mentor at my master's program, who's a prolific researcher, you know, one of the giants of the field, like just being one of his students opened me up to a lot more opportunities than somebody who just went over to this little school and had been there the whole time, right? So I think for me, one, the diversity of the educational experience, right? Grand Canyon's one type of school versus going to another school that's larger, smaller, whatever. 2, I think the experience and the reputation of the faculty that you're training under has a lot to do with it. And then 3, not every school has the specialty areas from top to bottom. So if you want to go into, you know, neuropsych stuff, like I don't know that this Grand Canyon would offer that if they had a doctoral program, right? So, but also like I know a lot of people nationally and internationally because of my experience of going to different schools, right? Some of them were students I was with, like I went to school, there was a guy who's now a professor in Korea, there's a woman who's a professor in the Philippines, there's a guy in China, and so if I go to a conference, like, then I get to meet their colleagues internationally, and there might be an opportunity for me to either collaborate with them or work with a team internationally that's coming over here to train, you know, so that opens doors. Those relationships all the way back to grad school when we're, you know, bitching and complaining about how hard it is and over beer and pizza that we couldn't afford, like that created a relationship that, you know, still, even though I don't talk to them every day, like still goes on. So I'd say there's pluses and minuses to it, and you have to figure out, does this school continue to, if you're gonna stay at one school, does it continue to offer me the opportunities to build relationships beyond, you know, this boundary? So that's something you kind of have to ask for yourself, you know, because on internship, like you have very little choice. Like I didn't have a choice but to go to New York. That was my only option. So I wasn't turning it down because I'm graduating. I've come this far. I'm out of here, you know. If I got to go to New York and be dirt poor and work my ass off, and so I can come back, yeah, great. That's what I was willing to do, you know. So, yeah.
What's one piece of advice you would offer someone into grad school that you wish you would have known going in?
Well, I wasn't a very good student as an undergrad, so I was like more, you know, graduated, oh, thank you, Lordy, than magna cum laude or whatever. Well, that's a tough question, because you know, grad school's hard. Like, I don't know how hard your undergrad program is here, but like grad school's hard. Like, and it's well, I don't know, because I haven't been in grad school in a long time, but like it's a lot of delayed gratification, right? If you want to be a psychologist, like I tell like some of the athletes I work with now that are in college, and they're like, how long did you go to school? I'm like, college? I went to college for 13 years, you know, to get to this point. And then then it took me another 10 years to really kind of get professionally where I felt like I was on good, solid ground, you know. So you gotta delay gratification. You gotta be willing to, you know, work extra hours. You gotta be willing to, not that you have to get abused, right, or taken advantage of, but like, you gotta be willing to like, do some of the grunt work, to build the relationships, to get the opportunities, you know. I was not on assistantship my first semester in my master's program. I was the only student not on a graduate assistantship. So any of the like shit work that needed to be done on a research project, I'll do it. Oh, you need me to transcribe a 45-minute interview, word for word? Sure, I'll do it. Oh, you want me to put this, you know, these 300 surveys in SPSS and run the data? I'll do it. And then my mentor was like, you know what, I got this grant coming up next semester with USOC. You're on it. Your school's gonna get paid, you're gonna get a stipend, you know, you've shown that you can handle the work. I wasn't sure, now I know you can. I was on assistantship the rest of the time. I didn't pay for grad school, right? So, you know, some people taught, some of the grad assistants taught. I didn't want to teach, you know, let them do that, right? But I was willing to do this other stuff because it got me to where I wanted to be, you know. I'd also say start with the end in mind. You know, the path's not gonna be straight, or at least most people I know it's not straight, but like, when you get thrown a curveball, or you don't get that assistantship you wanted, or you don't get that internship, like how can I use that to redirect me, right? I went to New York, I was working on outpatient substance abuse, not my thing, but my mentor there, Stanley Graham, he was like president of the APA for like 10 years.